Hi, Assalamualaikum. My name is Nurul Farisha Huda binti Aziz with a student ID of 20209665667. We are going to be presenting on effect of hand vibration on the development of vibration-induced disorder among cross-cutter workers research paper. This paper did a research on petrol handheld cross-cutter-induced hands-arm vibration syndromes, HAVS. HAVS can be triggered from ergonomic factor where repetitive working activities is involved. The vibration is transmitted from the cross cutter to the hand. According to Sajanya et al. 2022, the issue of hand grip disability due to working with vibrating equipment has been reported, where it has proven its correlation. On-site observation and measurement were used on subject participated in this study.
So next, I will be explaining the method used and the result of the study. First of all, the study collected data from 204 handheld grass cutter workers between 20 to 70 years old from the Highway Maintenance Company and the District Council in the South region of Medan Sula, Malaysia. Data include age and working experience collected, as it is very crucial to analyze the disability at the hand due to the grass cutting work. The study also monitored the color changes in the finger phalanx and the skin abnormalities before workers start their work. Among the instruments used also dynamometer. Workers were instructed to grip the dynamometer for 5 seconds to measure the hand grip strength before and after the grass cutting work. The other data calculated include mean and the total value of the grip force and compared with the worker's age. The observation of the color changes at the finger phalanx was done for the numerical scoring of the vascular and sensory neural assessment that indicate the severity stage of vascular and sensory neural diseases. Meanwhile, the SPSS Volume 19 software were used to calculate the frequencies and mean for the hand grip strength and hand numerical scoring. Highway mainline and building facility grass cutting workers is the high risk exposure group and low moderate risk exposure group based on the hand transmitted vibration duration. The result shows that 113 workers has been exposed to the hand arm vibration for less than 2 years. Meanwhile, 50 workers has been exposed to the hand transmitted vibration for more than 4 years. And 41 other workers has been exposed for more than 25 months and fewer than 48 months.
My name is Nurul Hatfina Hamizat. I will continue discussing about the findings from this study. As the vibration exposure continues, the pain will develop to injury or disease. The vibration tend to the changes in tendons, muscles, bones and joints, as well as affecting the nervous system. And this is known as hand-arm vibration syndrome, HAVS. Prolonged vibration exposure caused by the use of handheld grass cutter resulted in hand grip strength impairment, fingers blanching, and numbness. Based on the findings from this study, over 90% of the workers are at risk from the impacts of vibration exposure, which is hand grip strength. Among the causes of vibration disability, including forcefulness and repetitive movements. As the Stockholm Workshop scale was conducted to determine vascular and sensory neural disorders by hand numerical scoring, the findings were showed to have about 84.3% of workers had a vascular disorder in the left hand, while 79.9% of workers had a vascular disorder in the right hand. Based on the statistical data where the researcher used Pearson correlation, the numerical score data showed a significant differences between the two hands. The Pearson correlation of the left hand was negative 0.1, while the right hand was negative 0.26. It implied a negative relationship between numerical score and hand grip strength after work among handheld grass cutter employees. For vascular disorder at phase 2V, which is late, signifies numerous attacks of whiteness affecting the distal and middle as shown in this picture. Distal phalanx is the fingertips and middle phalanx is the middle part of the fingers. Numerical score recorded was in the range of 10 to 16. The most prevalent symptom among workers that utilize handheld vibrating instrument is vibration-induced white finger, VWF, or simply called as whiteness. When the hands are exposed to the cold, the symptoms of VWF could be worsened, whereas sensory neural stage 2 SM depicts persistent loss of sensation, namely numbness or tingling, and also reduces the sensory abilities. The numerical score was in between 9 to 16. The correlation between numerical score and grip force is negative, indicating no notable relationship between these two parameters as shown in the preceding finding.
The hand grip strength assessment and numerical scoring were used in this research and were able to help in monitoring the worker health on occupational hand-transmitted vibration. HAVS among the cross-cutter workers was induced due to the high severity on vibration transferred from the cross-cutter. When evaluating hand disability for industry risk, chronic health effects should be considered.